The impact of the disease on my life at that time, it was tough because it was kind of around the age when a lot of boys are going through puberty and they're growing, they're changing, becoming much, young, stronger men. And so I was kind of lagging behind that a bit. And then also with the Crohn's disease, just not being able to kind of take in the nutrients to grow.
I think it's really important to have a partnership with your patient because this is a lifelong chronic disease that they're living with. You can be supportive of them emotionally. You're guiding them through many stages of their life often. So if they're diagnosed as children, through young adulthood, all the way to the older adult, you're there as part of their team and you're a stable part of their team.
So I was always very, very, very skinny. And I don't really like looking back on a lot of pictures from that time. It's just memories of the difficulty, the pain. And I was fortunate that my friends at school, even acquaintances at school, no one picked on me. I never had any bullying. Everyone was very supportive. But it was still just difficult to see kind of everyone else changing and me still being so kind of frail.
The benefit of having access to a nurse that's been trained in inflammatory bowel disease helps you move through the process of being diagnosed, receiving treatment, and getting your disease under good control. Having access to somebody who understands the disease, having access to a nurse who understands the treatments, understands the investigations and all the number of tests that are involved, I think is helpful for the patient to really give them clear answers to their questions when they call. Unfortunately, we don't have enough IBD nurses in Canada, and not all patients across the country have access to IBD nurses, and we're hoping to improve those numbers.
Yeah, the change from having all those symptoms and not being able to keep on weight probably started around not long after I had transitioned to adult care and with my IBD nurse then, and finally found the right mix of medications that really worked.
One of the roles of an IBD nurse is providing education, nutrition, their medication or therapies that we use to treat IBD. And often we continue on through that with long-term management, how we're going to follow those patients and what they require for the rest of their lives to stay healthy with IBD.
In the last few years, and being able to be in a spot where my symptoms are managed, in no small part to my IBD nurse helping me along that journey. Now I know that the critical importance to maintain an active lifestyle, and without the right medication mix, without my IBD nurse monitoring that and making sure things are okay, it gives me a lot of confidence in the care team that they know that they're looking after me and managing my condition as opposed to just treating something in generalities.